My name is Stephanie Judd, and this is skill number 48, manually opening push and pull doors with the assistive devices of walkers, crutches, and cane. Before beginning, please refer to skills 33, 39, and 41 for appropriate fitting of assistive devices. Please then also refer to skill 32 for determining the appropriate assistive device for your patient. Some safety tips to consider before beginning include always being sure to put a gait belt on your patient to ensure the highest level of patient safety, and also remind the patient to always check for any obstructions in the doorway before moving through so that they do not fall on anything. The next 6 clips will show the patient independently moving through the doorway so that the therapist is not blocking view of what the patient is supposed to be doing. I will show a demonstration at the end of proper guarding of the patient. Instruct the patient to approach the door on the side containing the handle. Also be sure that the patient stays within their walker. Then tell the patient to shift their weight to their side away from the door handle and then to reach for the door handle with a hand that is unweighted. They will then push the door open just wide enough so that they can fit through. They will then proceed through the doorway. Once the patient has traversed through the doorway, instruct the patient to take steps within their walker until they are parallel with the door. Have them then shift their weight to the side away from the door handle so that with their unweighted hand they can push the door closed. Instruct the patient to approach the door on the side containing the latch. Remind the patient to stand outside the arc of the door in which the door will open when manually pulled. Have the patient shift their weight to the side opposite the handle and to reach for the door handle with their unweighted hand. Instruct them to pull the door open just wide enough so that they can comfortably fit through. The patient will then proceed through the doorway where they will then do the same sequence to turn around and reach for the handle to again close the door. Instruct the patient to again approach the door on the side containing the latch. The patient will then reach for the handle with the hand that is not holding the cane. They will then pull the door handle open so that the door is just wide enough for them to fit through. They will then proceed through the door. Once the patient has proceeded through the door, instruct the patient to take small steps until they feel comfortable that they may close the door with the hand not holding the cane. The patient will approach the door on the side containing the latch. They will then reach for the door handle with the hand not holding the cane so that they can push the door open. The patient will then proceed through the door and push it open even a little more if they need to make it through safely. The patient will then take a few steps to then push the door closed. Instruct the patient to approach the door on the side containing the latch and to angle themselves so that they are at a slight angle to the latch. Have them shift their weight to the side opposite the handle and then to reach for the handle with their unweighted hand. Have the patient then pull the door open just wide enough so that they can comfortably fit through. The patient will then return their hand to the crutch and proceed through the doorway. Once the patient traverses through the doorway, they will then make a turn so that they are facing the door. They will then shift their weight again to the opposite side of the handle and reach for the handle to pull it closed. They will then back up and repeat the sequence until the door is completely closed. The patient will approach the door on the side containing the handle. They will then shift their weight to the side opposite the handle so that they can reach for the handle with their unweighted hand. Instruct the patient to push the door open just wide enough so that they can comfortably traverse through the door. The patient will then travel through the door, and once through the door, they will do the same sequence to, again, push the door closed. This next clip is going to be a demonstration of how to properly guard your patient when they are learning to traverse through a doorway. So be sure to always explain to the patient exactly what you would like them to do and see if they have any questions before beginning. Hi Rachel, my name is Steph and I'm going to be your student physical therapist today. We're going to go ahead and move through the door, okay? I'm going to hold on to you just to be sure that you're safe, and then we're going to get through the doorway and then we'll teach you how to close it too, okay? Yep. So what we're going to do is I'm going to just hold on to your belt here. We're going to approach the door on the side containing the latch. Good. Now I want you to go ahead and shift your weight towards me. Good. Now go ahead and reach for the door handle with that unweighted hand. Good. And push the door open. Now, good. Now we're just going to move through the door. Okay, so now we're just going to take a couple steps inside your walker. Good. So then you're right next to the door, so it's right to your side. Good. Now I want you to shift your weight to that side. Good. So you can grab the handle. Go ahead and push it closed. Good.